Hello, Visionaries, and welcome to our series on improving report writing for health leaders. Today's episode is all about identifying the main pain points and assessing the current reporting processes in community health centers and the wider NGO community. Reporting is essential in our field. It supports funding, engages stakeholders, proves our program's impact, and ensures accountability to our communities. But as you know, it can also be time-consuming, complex, create periods of high stress and frustrations. And sometimes we question whether anyone reads the reports. Let's dive into practical steps to help identify areas that might be slowing you down or limiting your reporting's effectiveness and explore strategies for improvement. Main points. Understanding common challenges. The overwhelming frequency of reporting. One common challenge we face in reporting is simply how frequently reports need to be done. Weekly, monthly, quarterly? It seems like there's always another report to write. This frequency can create significant stress and frustration within teams. Let's break down some specific pain points to consider. 1A. Inconsistent formats across stakeholders. If you're juggling different reporting formats for different stakeholders, you're not alone. One funder might want a narrative report, while another prefers detailed data tables. This inconsistency can lead to confusion and inefficiency. Overlay text. Tip: group similar reports. One tip here is to group similar reports together and create adaptable templates that cover all requirements. Having a standardized approach will help cut down on time and errors. Additionally, this can alleviate the frustration of having to switch gears mentally, which can slow productivity and lead to burnout among staff. 1B. Inconsistent staff reporting templates. If each team member is using their own template, consolidating data can become very challenging. This often happens when there's no standardized template, leading to a mix of styles and formats. One practical tip here is to create or select one standardized template that everyone in the organization can use. This will simplify report preparation and reduce time spent on formatting. Reports can have subsections that apply to one or across many departments. Find the process that is right for you. 1C. Difficulty in accessing accurate real-time data. When data is outdated or takes too long to compile, or when departments capture the same measure differently, this can delay reporting or cause reports to miss out on the latest program insights. Consequently, this reduces their impact and can lead to poor decision-making based on incomplete information. Overlay text. Tip: use software solutions. Explore software solutions, whether through your EHR or simply through an Excel sheet, that enable real-time data entry and access. Alternatively, consider assigning one staff member to keep records updated on a regular basis. This can enhance accuracy and allow your team to focus more on analysis rather than data collection. 1D. Overwhelming volume of information. The sheer volume of information that needs to be compiled for reports can be daunting. Team members may feel overwhelmed trying to sift through various datasets to extract the necessary insights. This can lead to feelings of inadequacy, especially if they are not familiar with the data. Overlay text. Tip: prioritize key metrics. A practical approach is to prioritize key metrics that align with your organization's goals. By focusing on a few critical indicators, you can simplify the reporting process and reduce the pressure on your staff. Encourage them to seek help or collaborate with others when interpreting complex data. 1E. Fear of scrutiny and accountability. As reporting deadlines approach, team members often experience anxiety over the scrutiny their reports may face. The fear of being held accountable for inaccuracies can create a stressful environment where individuals are reluctant to take risks or innovate. Overlay text. Tip: foster a supportive environment. To combat this, foster a supportive environment where team members feel safe to ask questions and seek clarification. Emphasize that the goal of reporting is to reflect the organization's impact, and that errors can be learning opportunities rather than failures. Regularly review reports as a team to promote collaboration and knowledge sharing. 1F. Time constraints. With the constant pressure of deadlines, many find that the time allocated for preparing reports is insufficient. This can lead to rushed work, increasing the likelihood of mistakes and oversights. Overlay. Text. Tip: create a reporting calendar. Consider creating a reporting calendar that outlines deadlines well in advance. This allows team members to plan their workloads accordingly and allocate adequate time for each report. Having clear timelines can help mitigate stress and improve the overall quality of reporting. Quarterly. It seems like there's always another report to write. Here are some specific pain points to consider. 1A. Inconsistent formats across stakeholders. If you're juggling different reporting formats for different stakeholders, you're not alone. One funder might want a narrative report, while another prefers detailed data tables. One tip here is to group similar reports together and create adaptable templates that cover all requirements. Having a standardized approach will help cut down on time and errors. 1B. Inconsistent staff reporting templates. If each team member is using their own template, consolidating data can become very challenging. This often happens when there's no standardized template, leading to a mix of styles and formats. One practical tip here is to create or select one standardized template that everyone in the organization can use. This will simplify report preparation and reduce time spent on formatting. Reports can have subsections that apply to one or across many departments. Find the process that is right for you. 1C. Difficulty in accessing accurate real-time data. When data is outdated or takes too long to compile, or departments capture the measure a little differently than another, this can delay reporting, or reports can miss out on the latest program insights, reducing their impact. Tip: explore software solutions, whether through your EHR or simply through an Excel sheet, that enable real-time data entry and access. Or consider assigning one staff member to keep records updated on a regular basis. Assessing current reporting processes. Now that we've covered some common pain points, let's talk about assessing your current process to see where it might need improvement. Conducting a gap analysis. A gap analysis is a structured way to evaluate where your current reporting process stands in comparison to the ideal. Think of it as a tool to pinpoint inefficiencies. Some helpful questions to consider. What steps are taking the longest? Are errors or bottlenecks happening in the same places? Are there any duplicative tasks? Document every stage of your reporting process as you answer these questions. It may reveal insights about where specific issues are arising. A simple process flow using Post-its can help you in this activity. Involving staff as part of the solution. Often, frontline staff have valuable insights about what's working and what's not in the current reporting process. Engaging them in creating or refining reporting workflows can foster a sense of ownership and improve the system overall. Let's imagine we're asking a staff member how they feel about the current template. They might say it's too detailed for certain programs or too simplified for others. That's valuable feedback. Personally, I like to conduct team huddles. They are specific, short, and can address many outstanding issues on the spot, or at least kickstart the conversation. Tools for assessing reporting efficiencies. Now that we know what to look for, let's review tools to make the assessment smoother and more effective. Process mapping is a powerful tool that lays out each step of your reporting workflow in a visual format. It's especially helpful for spotting steps that don't add value or might even duplicate others. Imagine breaking down a reporting process into 4 stages: data collection, entry, review, and submission. You may realize the review stage involves redundant steps, or that data entry could be streamlined by reducing the amount of information staff are required to input. Evaluating reporting templates. Review your reporting templates regularly to ensure they're capturing the most essential metrics without overcomplicating things. Sample evaluation questions. Is the template capturing the key indicators that matter most? Are there sections that are rarely used or filled out? 3C. Staff feedback huddles. Huddles are short, informal meetings focused on specific topics. Hosting huddles with your team for real-time feedback can help keep the reporting process responsive to immediate needs and uncover issues early on. Set a regular schedule, like weekly or monthly, for these huddles. Ask 1 or 2 specific questions each time to keep the conversation focused. Stakeholder feedback surveys. Stakeholders often have feedback on the clarity, usefulness, and timeliness of your reports. Conduct a quick survey annually or biannually to capture their input. This can provide valuable insights into whether your reports meet their expectations and reveal areas for improvement. Reflection is key to continuous improvement. I encourage you to think about your current process and ask yourself a few questions. How do I feel about our reporting process? What have I identified as the biggest challenges? And are there solutions I haven't yet considered? If I've tried implementing changes, are they working as intended? Or could further improvement make it even smoother? Reflection is an ongoing process, and it's about creating a reporting workflow that's both effective and sustainable for you and your team. Thank you for joining me in today's session. We covered common challenges in community health reporting, from inconsistent formats and templates to tools for assessing efficiencies, such as process mapping, staff feedback huddles, and stakeholder surveys. In our next episode, we'll take a look at selecting tools and engaging staff for process improvement. First, join me in the V-Lab for a practical session on how to assess your reporting process. Come with your questions. I cannot wait to hear your insights. I hope today's tips were helpful, whether you're preparing monthly, quarterly, or annual reports. Don't forget to like, subscribe, and stay tuned for episode 2. You are making meaningful change.